But there is a lot more to this ailment that people need to know about, and that's going to be our topic tonight. So, Dr. Samet, I thank you for coming on the show.
Thank you for having me.
You're welcome.
I'm really excited to be here today to talk about arthritis.
So let's just start right off. What is arthritis?
Well, arthritis is actually a blanket term, and arthritis refers to pain in the joints, to achy, painful joints. And there's hundreds of different reasons why someone could have arthritis or achy joints. Today, I'm going to discuss mainly osteoarthritis.
Okay.
And that's because osteoarthritis is the most common form of chronic joint pain, and it's the most common chronic joint condition in the United States.
So question for you real quick before you go into that.
Yes.
Off the top of your head, how many types of arthritis would you say there are?
So like I said before, there's like hundreds.
Hundreds.
There's many different reasons to have joint pain.
And that's so funny. There's hundreds types of arthritis, but when somebody says the word arthritis, they lump everything into one category.
Yes. That's because most of the times it's osteoarthritis.
Got you. Okay.
And we're also going to talk a little bit about rheumatoid arthritis later in this program, because rheumatoid arthritis is one of the other common forms of arthritis.
Got you. Okay.
So osteoarthritis affects 27 million people in the United States. So 27 million. And half the people who are older than 65 have osteoarthritis. So what is osteoarthritis, right? I knew you were going to ask me that. So osteoarthritis, what you'll hear commonly is that osteoarthritis is wear and tear of the joint. But there's actually more to it than just wear and tear of the joint. Our joints are made up of the ends of bones. So a joint is composed of the ends of bones, and when they come together to form the joint is used, so that way we can move our skeletons.
Gotcha.
At the end of the bone, there is a protection on the end of the bone called the cartilage.
Gotcha. Okay.
And the cartilage protects the bone from rubbing on the other bone. Instead, it's
kind of like insulation.
Yes, it's sort of like an insulation.
Gotcha.
It's sort of like a little bit of a shock absorber in the joint, and it helps the joint move and without pain, without difficulty. Now, in osteoarthritis, there's a defect in the cartilage, and what happens is that the cartilage starts to break down and starts to wear away. Now, that can result in areas where bone touches bone inside of the joint. And that's what causes quite a bit of the pain and the dysfunction in the joint. There's also times when in osteoarthritis, not only is there cartilage breakdown, but pieces of cartilage or pieces of bone inside the joint can break loose into the fluid in the joint and cause there to be pain and swelling in the joint.
So basically, your joints are covered with a muscle which is called cartilage.
It's not quite a muscle. It's a material. It's like a covering, covering material, but not a muscle.
Okay, and it's called cartilage.
Yes.
And over time, well, I guess you have a lot of cartilage when you're young, but then as you get older, through the wear and tear, that cartilage starts to degrade,
yes.
And now the arthritis is basically your bone, kind of like when you're driving a car and they say you got to get new brake plates and you have the scratching somewhat.
Yeah, pretty much
cool.
like getting new brake pads.
Got
Almost
you.
The brake pads are almost like the cartilage.
Got you. Okay,
Yeah.
Good analogy.
And that's a great one.
Okay.
So it's very common for people to have osteoarthritis, and one of the common myths is that osteoarthritis happens only in older people, but actually that's not the case at all.
Okay.
And osteoarthritis can affect people of all ages, but it affects older people more.
Because of the wear and the tear.
Exactly.
So what is the youngest that from your experience, you've heard of an individual getting
osteoarthritis?
Yes.
So for osteoarthritis, I've seen people start to have it in their 30s and in their 40s. And we're going to talk about some of the risk factors for osteoarthritis, but you can see it in all age groups, pretty much.
Okay.
But usually 30s and up, and it's most common in people over the age of 65.
So since you, because we still have a couple more minutes. Can you just then what is rheumatoid arthritis?
Okay, so before we talk more about osteoarthritis, I'm just going to tell you about rheumatoid arthritis briefly. So rheumatoid arthritis is different than osteoarthritis. Osteoarthritis, again, we think of it as degradation of the cartilage over time or from injury even.
Oh, okay.
And rheumatoid arthritis is different because it's the body's immune system, which normally attacks infections. It protects our bodies from infections.
It attacks the muscle.
It can then attack the joints.
The joints. Okay.
So it's a different process, and that is a much less common form of osteoarthritis. So
Gotcha.
only 1 to 1.5% of the population has rheumatoid arthritis.
Okay, good, great.
But we'll talk about that.
I'm just saying, I'm saying is that as far as rheumatoid arthritis, I've always heard.
Yes.
But I've never actually, I never knew what it was, and it's basically an infection, or
it's not exactly like an infection. It's the body's immune system.
Immune system. Sorry.
It's the immune system. Again, we use this to attack infections in the body. There's blood cells, specialized blood cells in the body that attack foreign invaders in the body. And instead of attacking just foreign invaders, it starts attacking the lining of the joints.
It kind of sounds like lupus, but that's I'm going.
Yes, that's very good. Actually, lupus is also an autoimmune disease.
Yeah, okay.
So they both autoimmune illnesses.
Gotcha.
The difference is in that osteoarthritis, it's not characterized by that autoimmune component.
Okay. So you can go back and I'm sorry that I threw you off.
Oh no,
we can
never.
go back to the other arthritis that you were talking about. Okay.
So when we think about, osteoarthritis affects the joints that it affects the most are knees, hips, hands, the lower back, the neck, and the feet. In my arthritis clinic at Harlem, I see people who have a lot of knee osteoarthritis and a lot of hand osteoarthritis. Now, osteoarthritis tends to be more common in women than in men, but not that much more common in women than in men. So it's almost 2 to 1 women to men.
Okay.
So and osteoarthritis of the knees and the hips occurs more commonly in people who are overweight or obese. Because what happens is, with that extra weight, you're putting extra pressure on your joints. And over time, that extra pressure is wearing down at the joints and getting rid of your cartilage. So that's one of the big risk factors. So the major risk factors are, as we get older, the elderly have a higher risk of having the osteoarthritis. If we're overweight or if we're obese, then that makes us at a greater risk for developing osteoarthritis. And if we're a woman, unfortunately, that's also a risk factor. But fortunate to be a woman. I'm sorry, fortunate to be a woman. You know what I mean? Uh-huh. And now there's a form of arthritis, osteoarthritis, that happens more commonly in joints that were already broken. So that's something we call secondary osteoarthritis. So osteoarthritis can happen in joints that were previously fractured, or any joint that has had a surgery in it. Those joints are affected more by osteoarthritis. and those joints deteriorate faster than osteoarthritis.
So the question I want to throw out to you, because I go on the internet and I pull up some of the questions that people have who know nothing about arthritis. So, and I think you probably answered it. The reason why you may hear popping and cracking, is that because the bones rubbing together? Because there's no cartilage?
Okay. So cracking knuckles is not, it's a different process, actually.
Okay.
And actually doesn't have to do with arthritis. You're just changing the pressure inside of the joint. And one of the common myths, actually, is that cracking knuckles increases arthritis.
Well, actually, I'll read exactly what it says. It says, why do joints make popping and cracking noises? And does cracking your knuckles cause arthritis?
Yes. So when you crack your knuckles, it does not increase the risk of osteoarthritis or any form of arthritis. It's okay to do. And the other thing is, why would a joint make popping or clicking noises?
Yeah, it said why do joints make popping and cracking noises?
Cracking noises. So you can occasionally hear cracking in knees of patients who have osteoarthritis. And that happens because there's areas where there is bone hitting bone, and you can feel the cracking when you put your hand over it and make the knee straight.
So funny. The other day, I was swinging my leg, and it sounded like my knee was squeaking, like I don't know if that was weird. I mean, I don't know if that's something that's now, but that's something that I realize sometimes, that it's like a squeaking noise.
So that can happen with a little bit of arthritis, and different forms of arthritis can do that. But osteoarthritis in the knee can certainly give you a creaking in the knee that you feel when you move your knee. It can also be a sign that the quadriceps muscles are not so strong, and that maybe it's a sign that the person needs to exercise. Okay.
She just told I need to exercise and I'm getting old.
No, I did not say that.
It's all good. Thank you for this information. Right now, the time is 7:15. You're listening to Health in Harlem on Whcr 90.3 FM New York, the voice of Harlem. Please stay tuned. We'll be right back with some more valuable information. But if you have any questions or any comments or any concerns, please hit us off at 212-650-2903. That's 212-650-2903. And stay tuned. Don't leave. And we'll be right back.
WHCR 90.3 FM, New York.
The first festival occurs May 3rd through May 4th at the Malcolm X Betty Shabazz Center, 3940 Broadway near 165th Street in Manhattan. For information, 917-946-8903, 917-946-8903. The film festival features Al Ghazali, The Trials of Muhammad Ali, Return to Gorée, and 8 Centuries of Islam in America. May 3rd through May 4th. Information, 917-946-8903, presented by the Mosque of Islamic Brotherhood Communications Department.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
Tougher than walk. Said I'm black. I'm tougher than walk.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen of the listening audience. This is Sean Shivers, and I'm your host tonight for Health in Harlem on WHCR 90.3 FM, New York, the voice of Harlem. And our guest tonight, Dr. Amanda Samet. Got it right. Thank you. She is the chief of rheumatology at Harlem Hospital Center. She's also the assistant clinical professor of medicine at Columbia University. And our topic tonight is arthritis. One thing I want to do, I want to apologize. I think I threw the phone number out there by mistake. Our number, hit us off, call us. Any questions, comments, or concerns, 212-650-6903. That's 212-650-6903. So before we left, we talked about arthritis, the two types of arthritis, and one is rheumatoid arthritis, and the other one is osteoarthritis. Okay, and before we flip into the next segment, I forgot I got all these announcements that I have to make. There's a lot of positive things. There's a lot of things going on at Harlem Hospital, and we're going to make sure that every single week you know what's going on. This Friday, May 9th, at 9 o'clock, Harlem Hospital Center's Family Planning Program, Cancer Control, WIC Radiology, and Metro Plus will host a Mother's Day event on the second floor of the Ronald Brown Pavilion. There will be breast health presentations, games, prizes for mothers, etc. So it's Mother's Day. If you're a mother, if you're going to the clinic tomorrow, there's a whole host of things going on. And if you want more information, I want you to hit my girl off, Vanessa Austin. She was just here 2 weeks ago. The number 212-939-8310. That's 212-939-8310. So if you're sitting in that clinic and you know you're going to be there for an hour or two, there's going to be a lot of activities going on. And the word is free of charge. So there's going to be a lot of free things going on. Okay, and another thing I want to bring up real quick is that you are cordially invited to join us as we celebrate Women's Health Month. This month is Women's Health Month, and on Thursday, May 15th, next week at 6 p.m., Reverend Lakeisha Waldron, Warond, from the First Corinthian Baptist Church, she is going to have a discussion at Harlem Hospital Center, the path of total wellness, mind, body, and soul. So, and this is going to be at Harlem Hospital Center in the Merle Pavilion Auditorium. That's on the second floor of the MLK building. If you want more information about this lecture, this presentation that she's given of mind, body, and soul, you can hit us off at 212-939-1370. That's 212-939-1370. And I have about 5 or 6, but I'm going to wait for the other segments to say those. So,
can I also make a few announcements?
Sure, go ahead.
Okay, so May is also Lupus Awareness Month.
Get out of here.
Yeah, and it's also Arthritis Awareness Month.
Stop. No, I'm playing.
and again, happy Mother's Day to all the mothers out there, especially to my mother and to Ema. And
to my mother.
and also happy birthday to my little sister. It's her birthday today.
Hey.
And she's listening.
Did you say Ema? You call your mother Ema?
So that's my mother-in-law.
Oh, okay.
Yes.
Hey, Ema. Okay.
All right, now we can talk about arthritis again.
Yeah, so now can we speak on signs and symptoms of arthritis?
Yes.
Or at what point in your life, at what point should you go get checked?
Okay, that's okay. We'll talk about that. So, as people get older, aches and pains and muscles and joints are very, very common. And actually not just as people get older. I think this is, after the age of 20, everyone has aches and pains. But the question of when do you see the doctor, You want to see the doctor if you have some pain that's not going away. If you have pain in a joint that's going on, not getting better with Tylenol, and especially if you've injured a joint, or if you've had an injury or any trauma, or if you've been in any accidents, definitely see a doctor. The other reason to go to see a doctor soon would be as if any of your joints are swollen, or if any of them are red or hot or exquisitely painful.
Gotcha.
Then that's a reason to go to the doctor, because sometimes joints can have infections in them, or sometimes joints can have something else called gout, which we're not going to talk about too much in this show, but that does deserve attention.
Gotcha.
And it would be something that should make you go to see the doctor.
I want to ask you a quick question about pain and fatigue.
Yes.
What's the difference between pain and fatigue?
Okay, so fatigue usually is more of something that people feel that they have, almost like they were drained of energy, like someone...
Is it an achiness?
Not necessarily any achiness. People just feel tired, exhausted. They feel like they just want to go to sleep. They feel really tired. They feel like they have low energy levels.
Got you.
But fatigue is not painful.
Got you. Okay.
Yeah.
Okay. Just want to clear that up.
Yes.
I'm sorry. So continue. I'm sorry.
Okay.
I threw you off for a loop.
Common symptoms of osteoarthritis. Common symptoms of osteoarthritis are usually pain or stiffness in the joint that's affected. Now, knee arthritis, I'm going to talk about knee and hand arthritis separately. And I think those two, knee and hand osteoarthritis are the most common arthritis forms that I see in my arthritis clinics. So for knee arthritis, what people will come in with is pain in the joint, stiffness in the joint, stiffness that they feel after periods of rest. So if they're sitting for a while and then they need to get up, it takes them a little time to get going. It takes them time to loosen that joint up. They can also have trouble going up or downstairs. That's also pretty common in osteoarthritis. And then when knee osteoarthritis is severe, people will have trouble walking more than a block or two, and people will also have trouble standing in place for more than 20 minutes. So those are more signs of severe osteoarthritis in the knee. So,
and that's basically when you're going to need a walker or a cane or a walker or...
At least.
Got you. Okay.
And in terms of hand osteoarthritis is much more common in women than it is in men. And if you look at your hands, the joints that are affected in hand arthritis are the ones that are closest to the fingernails. So you see those ones that are close to the fingernails? Mm-hmm. Those joints in your fingers, the ones that are close to the fingernails, can get bony growths on them that can be quite painful. Also, the next joint, the one that is after the joint, so both of the finger joints that are not the knuckles, the other two that are not the knuckles, those are the joints that are affected by hand osteoarthritis. And we see that more commonly in women. And what they will have is they'll have pain, and they can have a little bit of swelling in their hands and some trouble. So when the arthritis is causing a lot of pain, they'll of course have difficulty lifting small objects. They can have trouble writing. I had a patient today who was having trouble when she was typing. I've also seen a patient who was a pianist, and she had quite extensive arthritis in her fingers. And so the arthritis in fingers definitely is worse if you overuse the joints.
So is the reason why it affects those areas of your fingers because of those areas that you use the most?
In osteoarthritis, it's partially genetic and partially from use.
Got you. Okay.
Yes.
Okay.
Yes.
So now, since you threw the word genetic out there,
yes.
So is arthritis genetic? Like if your mother or your father or your grandparents have it, what is it likely of you possibly? Well, you did say over the age of 65 that you will get arthritis.
50% of the time, yes.
But is that a factor? Is that a big factor?
Yes, it is. So genetics are important in osteoarthritis and rheumatoid arthritis. Genetics in osteoarthritis play a role, especially in hand osteoarthritis in women. So if you're a woman and you look at your mom's hands, if your mom has osteoarthritis in her hands, you have a 50% chance of having that same arthritis that your mom has in her hands. With knee arthritis, it's a little bit less so genetic, but there's also a component of genetics there. But even more than genetics, with knee arthritis and hip arthritis, it's lifestyle. It's are you keeping a healthy weight? And what was your job, or what's your occupation? People who are gardeners or people who kneel on their knees end up having damaged their cartilage more, and so they're more prone to having osteoarthritis in the knees. Or people who are mechanics or carpenters can develop more hand osteoarthritis. So what you do with your joints also makes a difference.
Now you're mentioning mechanics and carpenters. Would it be safe to say because they're kind of doing the same motion a lot of times?
Mm-hmm. Yeah,
Okay,
so
all right.
overuse of the joint, yes.
Okay, all right.
Yeah. So those are the major symptoms and signs of osteoarthritis of the knees and the hands. And we'll talk about rheumatoid arthritis a little bit after.
Okay. And you just hit around the nail. The time right now is 7:29.
Oh, okay.
So, again, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We will be, we have to take our next commercial break, but we're going to be right back with some more valuable information. Again, I'm letting everybody know, please don't be stingy. You're going to hear all this good information. Pass it on. Tomorrow you're on the train, you're on the subway, turn to the person next to you and say, guess what? I was listening to Health in Harlem and they were talking about arthritis, and I'm going to tell you what I learned. Probably going to knock you, but But please stay tuned. We'll be right back, okay?
WHCR 90.3 FM, New York.
Hey, Mom, why is the sky blue? Why don't animals talk? Why do dogs have wet noses? Why is an 11 pronounced 1T1?
Kids ask a lot of questions.
Why do I have a belly button?
But you don't have to know every answer.
Why is the ocean salty?
Because you don't have to be perfect to be a perfect parent.
Why are there 50 states?
There are thousands of children in foster care who don't need every question answered.
Why is pizza round?
They just need you. For more information on how you can adopt, go to adoptuskids.org. A public service announcement from the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
You are a waste, a loser. Everyone hates you. Why don't you just stay in your car and keep driving? I'm serious. Drive until you run out of gas, then get out of your car and walk until you find someone who doesn't think you're dumber than bricks. Could take a while, but at least all that walking might burn a couple of calories.
You may not witness bullying like this every day. Your kids do. They want to help, but they don't know how. Visit stopbullying.gov to learn safe, simple ways your child can help stop bullying. Be more than a bystander at stopbullying.gov. A message from the Ad Council.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
Tougher than rock. Said I'm black. I'm tougher than rock.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen. This is Sean Shivers. We're on our third segment Listen to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. And our show tonight is arthritis. We have Dr. Amanda Summit, and we're going to continue the conversation. But before we do, I have to give a quick shout out to about 800 people at Harlem Hospital, and this are nurses. This is Nurses Month, Nurses Week,
Yes.
Nurses Week, and Denise Suarez, who's the executive director, she is also a nurse as well. And I'm just going to read this real quick. Patients travel a journey that includes illness, disease, injury, or physical challenges. On that journey, many find a bridge to cross where they can improve their conditions. Our nurses are that bridge. Carl Crichton, Chief Nursing Officer, and his team works hard to deliver clinical care, comfort, and support that meets and exceeds the expectations of patients at Lincoln Medical Center and Mental Health Center at the Renaissance Healthcare Network. You have Karen Dirk, D-U-D-E-K, RN, Network Director of Nursing and Diagnostic and Treatment Center, leads the team who shares their gifts of healing in the community health center and schools-based health programs. And at Harlem Hospital Center, Dr. Yannick Joseph, that's my girl, Chief Nursing Officer. The team in the Department of Nursing is a constant and effective champion for high-quality patient care and safety in nursing practices. I'm going to cut it right there because of the fact, one thing I want to definitely say, these individuals, and I know Dr. Joseph not personally, I know her very well as one of my colleagues, and she has such a passion when it comes to the care of patients that she passes on to her nurses. It just, every day when I walk into the hospital, it just makes me more and more say, I love working at Harlem Hospital. So again, I want to give a quick shout out to our nurses. We thank you. The community thanks you for all that you do when they walk through that door. Okay?
Happy Nurses Week.
So we're going to get back to the topic of arthritis.
Should I summarize?
You know what? Let's summarize to the third segment, to the last segment.
Okay.
So let's talk about treatment and prevention.
Sounds good.
Let's just say someone comes to the hospital for the first time and they see you. What is that experience?
Okay, so we have 3 arthritis clinics at Harlem Hospital. When a patient comes to the arthritis clinic, we first ask the patient a series of questions to figure out what type of joint pain the patient's having, which joints are affected, what makes the joint pain better or worse, what medications have they tried, have they exercised, what is the function of the joint. And there's a whole list of questions that we pretty much go through, a whole assessment that we go through. And then the joint there's a full joint exam that's performed. So we take a look, we feel the joints that are painful. We also assess the joints to make sure that their range of motion and that their function is good. Depending on the questions, the answers to the questions that the patients give, and depending on the exam, we may order x-rays of the joint. In some cases, we would order blood work if we were concerned that the patient may have a different form of arthritis other than osteoarthritis. There's no blood test for osteoarthritis, but there are blood tests for rheumatoid arthritis. So then we would do that sort of a workup. And if there's already x-rays done, we look at the x-rays, we show the patient their own x-rays so they can actually look at their joint, and we point out what's going on in the joint. And then depending on what's found, that will guide us in the management.
Okay.
Yeah.
So let's say you kind of you do all of that, and the individual has some type of arthritis.
Yes.
Treatment.
Okay, so let's say that the patient has osteoarthritis, the most common form of arthritis in the United States, and actually the most common reason for disability in the United States.
Now, when you say disability, individuals who, as far as their hands are...
knees, hips, back. That's the most common
wheelchair,
reason for disability.
Yeah,
so some people would be in a wheelchair.
Okay.
So the treatment for osteoarthritis, there's two parts. One of the parts of treatment would be the treatment that doesn't involve medications. So say, for instance, someone has knee osteoarthritis. The major treatment would be for the patient to lose weight if they're overweight or if they're obese, to lose weight. Because by losing weight, it will take pressure off the joints. So again, if you're 10 pounds overweight, that's an extra 30 to 50 pounds of pressure on the knees when we walk. There's extra pressure on the knees being farther down. And when we walk, we exert more pressure. So by losing 10% of your body weight, if you're overweight, your pain will go down by 50% without any medications or any other treatment. And that's been shown and proven in studies.
I'm just curious to know, so have you ever had a situation where, because I know it's very difficult to lose weight, where basically had to have a patient have bariatric surgery or something like that? Has that happened on...
Unfortunately, yes.
Gotcha.
Unfortunately, yes. The other treatment would be that's part of the treatment. Another something that we make sure that every patient with osteoarthritis in the knee does is go to physical therapy. And physical therapy will strengthen the quadriceps muscles. The quadriceps muscles support the knee, and they would take pressure off the knee and decrease the force on the knee. So by having stronger muscles around the knee, you're going to put less pressure on your knee, and your knee is going to be less painful. So all of our patients who have knee osteoarthritis are automatically sent to physical therapy, so that way they can go through a course of physical therapy and learn the exercises. Now, once that's done, the patient should continue to exercise. And exercising when you have joint pain is quite difficult. So if someone has difficulty walking and the pain is too severe with walking, we generally recommend swimming or mat exercises like Pilates or yoga. So low impact exercises, not running on a track or something like that. If a patient smokes, of course, we tell them to stop smoking. And that's because not only... So smoking is horrible for joints. Even for people who don't have osteoarthritis, if you smoke, you actually will damage your cartilage. Again, that cushion that protects the bone, you're going to damage that at a higher rate than someone who doesn't smoke. And if you smoke, you're also at increased risk of developing rheumatoid arthritis, the other arthritis, the one that's the autoimmune inflammatory arthritis. So stopping to smoke is part of what we recommend to all our patients who smoke, and especially patients who have osteoarthritis or rheumatoid arthritis. So those are the therapies that we call non-pharmacologic, or the treatments that don't involve drugs or medications.
I have a question, and I'm just thinking right now. Whenever someone, let's say they have back pain or they have hip pain or whatever, and the first thing they say is that I'm going to go to a chiropractor. How do you know that? And I hear that all the time. How do you know? And I hope I'm not changing the subject though, but you have pain and you go to a chiropractor versus you need to go check because it may be arthritis. Is there any way? And that's the first arthritis, the osteoarthritis. But do you understand what I'm trying to say?
Yes, absolutely. Chiropractors are not medical doctors.
Okay.
And so actually it's important to go see your primary medical doctor, go see your primary medical doctor first to make sure it's okay to go to a chiropractor. You don't want to go to a chiropractor unless you've been cleared already by your primary medical doctor, because you may have a condition that might get worse with manipulation.
Now, someone who may believe that they may have some type of arthritis, they still should go to their PCP, their primary care doctor.
Yes,
first.
Usually the primary care physician is the first stop, and then they usually will start the treatment for osteoarthritis.
So what
I'm sorry. I'm sorry. And then if the case is more difficult, or if a patient has a different form of arthritis other than osteoarthritis, then they are sent to a rheumatologist, which is what I do. So I'm the rheumatologist, but I will see patients who have osteoarthritis or any form of arthritis.
So the question I'm going to throw out to the community, and I always say this every now and then on Health in Harlem, is that anybody listening, are you in pain? Do your joints hurt? Do you have a headache? Or are you in pain in general? I want you to raise your hand. If you are in pain, I want you to go to your primary care physician and check on that pain, because I believe that people walk around here with pain to the point where they just think it's a normal way of life. You should not be walking around in any type of pain. Go to your PCP, check on what that pain is, so they can send you to a correct specialist or whatever to get that fixed. I just want to throw that out to everybody real quick.
And then the other part of treatment for osteoarthritis involves pain medications. And the pain medications, usually first we start with actually over-the-counter medications like Tylenol. And if that doesn't cut it, then patients usually are put on other medications similar to Advil or ibuprofen.
Like Oxy or...
Not oxycodone.
Oh, okay. That's a strong one.
That's a stronger one. But the thing about Advil, Aleve, Motrin, ibuprofen, those are all drugs that are called non-steroidal anti-inflammatory drugs. Those are excellent for pain. But unfortunately, in our community and in Harlem, there are many people who have kidney disease. If you have kidney disease, don't take any of those medications without first asking your physician, because they can worsen kidney disease.
Oh, shoot. Didn't know that.
So even over-the-counter medications can be potentially dangerous. Just because you don't need a prescription doesn't mean it's necessarily safe. And we've seen people who've come in who've taken Advil for years, and their kidney disease has gotten worse. And that's we need you to protect your organs. And there are other options for managing the pain other than that group of medicine, which can be dangerous to the kidney. So if that group of medications is one that we can't use, then we use a different medicine called tramadol. And tramadol is a safer medication. It's a controlled substance, so you need a prescription, and the prescription only will last usually for 30 days.
Gotcha.
And then another treatment would be giving steroids into the joint. So injecting steroids into the joint for osteoarthritis in the knees.
So on that note, because I have a couple of questions, we're going to go to commercial break, and when we come back, we're going to talk more about the steroid injections. You're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We're going to take our next commercial break in our last segment. But if you have any questions, comments, or concerns, just want to hit us off, hit us at 212-650-6903. That's 212-650-6903. Stay tuned. We will be right back.
WHCR 90.3 FM, New York.
Enjoy a red-hot night of music at the world-famous Apollo Theater as Arturo O'Farrill and the Afro-Latin Jazz Orchestra reimagine Chico O'Farrill's Afro-Cuban Jazz Suite in the world premiere of Afro-Latin Jazz Suite. This Harlem Jazz Shrines event will be held on Saturday, May 10th at 8 p.m., featuring performances by Cafe, Freddie Huevito Labaton, Rudras Mahanthpa, DJ Chilo, Logic, and a special tribute to Randy Weston. That's Afro-Latin Jazz Suite on Saturday, May 10th at 8 p.m. at the world-famous Apollo Theater. For tickets and more information, visit www.apollotheater.org.
The Educational Theater Program at the City College of New York proudly presents The 2014 Family Arts Day, Saturday, May 10th from 10 a.m. to 1 p.m. Family Arts Day offers free fun for everyone. There will be theater games, face painting, puppets, sing-alongs, clowns and mask making, live performances, and much more. That's Family Arts Day, Saturday, May 10th from 10 a.m. to 1 p.m., held at Aaron Davis Hall on the campus of the City College of New York at 135th Street and Convent Avenue. For a full schedule of events and directions, visit www.ccuny.edu/edtheater.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen. This is Sean Shivers, your host tonight for Health in Harlem. WHCR 90.3 FM, New York, the voice of Harlem. And this is our last segment. But before we continue, I just want to make a quick announcement, and I should have said this earlier. The city is low. We're low on blood. Blood is something that is essential. Blood is something that you need in the ER, in the hospitals. You know, something tragic happens, you're in the hospital, you don't have the correct blood, death. So please join our Senior Vice President, Ms. Denise Suarez, RNMA, on May 12th from 12 p.m. to 6 p.m. at Harlem Hospital Center, and May 14th from 7 a.m. to 5:30 p.m. at Lincoln Medical Center in the Conference Center for our annual blood drives. Our community blood supply is becoming critically low, and supply has not kept pace with demand. As employees, as people in the community, we know firsthand how precious a blood donation can be. Your donation and ongoing support will make that difference. So please come to Harlem Hospital, go to Lincoln Medical Center on those dates, and donate. You know what I'm saying? You'll feel good at the end. All right. So, Doctor.
Yes.
Let's continue our conversation on arthritis.
Okay.
And you was talking about steroids.
Okay, so steroid injections are a treatment that are given for knee osteoarthritis. Now, they don't stop the progression of osteoarthritis, or they don't stop the progression of damage, and they cannot reverse the damage in the knee joint. So, at best, it may help decrease the amount of pain for a few months, and that's in cases where the osteoarthritis is in its earlier stages. So the steroid knee injections are something that's offered only to certain patients, not to everyone with knee osteoarthritis. And again, everyone has everyone is a little bit different. So when it comes to osteoarthritis, the management is also different depending on exactly how severe the
and the reason why
arthritis is.
Said that I definitely want to make a comment once we come back from commercial break, because again, we're going to go back to the chiropractor. From my experience, this is my experience. I have joint pain, my back pain, and the doctor says, "Do you want an injection?" And they give the injection, and it numbs the area, and the pain goes away for about a couple of hours, but then it comes right back.
Exactly.
Yeah.
So with the knee injections, there's two medications that are injected. One of them is the steroid, and that stays around for a longer period of time. And one of them is something called lidocaine. Which is what you get also when you go to the dentist.
I was about to say that when you get your tooth pulled. Yeah.
So that actually will numb the knee for a few hours, but then the steroids take over the next day and for a few days after that. But in my experience, the steroid injections for the knees have not been that great. They have not been that great, but they may help certain patients.
Now, steroids also, that's a Band-Aid, basically. It's not really...
Exactly.
It's a Band-Aid, temporary. Gotcha. Okay.
Yeah.
Cool.
But same with the pain medications, too, because, we don't have a cure for osteoarthritis.
Gotcha.
Yeah.
I got you have mentioned also about some type of gel.
Yes. So there is a gel called capsaicin gel. And this gel is helpful for people who have arthritis in their hands and have painful arthritis in the hands. And this is something that's rubbed on the hands twice a day. And then afterwards, you make sure that your fingertips don't have any on it. Wash them off your fingertips, because if you touch your eye after, you'll have a burning eye.
Gotcha.
So capsaicin actually comes from peppers. And it's a substance that burns, and it actually will take away pain.
Oh, okay.
And it works for arthritis in the hands, but not so much for the knees.
Now, I had a foot injury, and I hope I'm not going off the subject, but I was given some type of gel, and when I rubbed it on, it had a cold sensation to it, and the pain kind of went away. Is that the same effect as that?
It's similar.
Similar, okay.
So there's also things like Bengay or Icy Hot. Those are what you can get.
This was like some type of, was it a prescription? I don't know, but it had a ball, and it was like a ball, and you rub it on, whatever. And I think it was like bluish in color.
Yeah, sounds like Icy Hot, but those can help.
Okay.
But again, everything is pretty temporary.
Got you. Okay, so what is going on at Harlem Hospital as far as making individuals more aware of the programs that you have as it pertains to arthritis prevention?
So there's a lot of educational projects for a lot of educational talks for the medical residents, for the medical students, and also for the primary care physicians. We're going to be giving a lecture soon on arthritis, on different forms of arthritis, mainly osteoarthritis, because that's what we see most commonly, but also rheumatoid arthritis.
Gotcha. And I think you mentioned something about a walker. Did you mention about a walk that you're having, or am I thinking?
Oh, yes. There's going to be an arthritis walk. The Arthritis Foundation is going to have an arthritis walk on May 17th.
Okay.
It's in Foley Square Park across the Brooklyn Bridge in New York, New York.
Got you.
And another thing that I just wanted to mention, if you think that you have arthritis, or if you know you have osteoarthritis or rheumatoid arthritis, there's a great website.
Okay.
It's the Arthritis Foundation website, www.arthritis.org. And this website has great information on osteoarthritis or rheumatoid arthritis, all the forms of arthritis. It also has information on how to lose weight and tips on exercising for people who have arthritis. It's great. It has videos on specific exercises to do depending on which joints are bothering you. So it's a great resource for people.
And can we go back for a second? You have mentioned about the walk itself.
Yes.
Let's just say somebody want to participate in that. How would they get more information?
So for more information, go to www.arthritis.org and look, and it will be on their website. It's on the Arthritis Foundation's website.
Gotcha. Now, let's just say someone is listening right now, and we did talk about going to your PCP, your primary care physician. But let's just say somebody wanted to, is there a number that someone can contact at Harlem Hospital?
Yes. If someone has rheumatoid arthritis or even osteoarthritis that they're having difficulty with management, you can call 212-939-8111.
What's the number again?
212-939-8111. And you could ask to make an appointment.
Cool. Oh, so the last thing I was going to say, because we have a couple of minutes left, a few more minutes, is that Dr. Summit, am I saying your name?
Samet.
Samet, I'm so sorry. But we talked about a lot of stuff.
Yes. So the take-home message?
What's the take-home message? So out of everything that you said, what is one or two main points that you want everybody to get out of
this talk?
Yes.
The main point, osteoarthritis is the most common form of arthritis in the United States. It's a form of arthritis where cartilage breaks down and there's degeneration in the joint. It causes pain and stiffness and loss of function in the joint. Rheumatoid arthritis is a different form of arthritis, and sometimes people will confuse it with osteoarthritis, but rheumatoid arthritis has a lot more inflammation. The knuckles and the wrists are involved more, and it's more of an autoimmune disease that affects women more commonly than men. I didn't talk too much about rheumatoid arthritis in this talk. I talked mainly about osteoarthritis, but when you go to your physician, it's important for you to know which form of arthritis you have.
But that's okay, because the next time you come on the show, you're going to say, I'm going to continue where I left off at, and I'm going to talk about rheumatoid arthritis.
Yes.
Excuse me. Dr. Salmon, I want to thank you for coming on the show.
Thank you.
It's greatly appreciated. So to everyone out there, first of all, I want to say is that my boy Maurice hopefully is going to be back next week. I've been on here. I mean, I've enjoyed it. I've been here by myself, but he's going. My partner in crime hopefully will be back here next week again. He's over in Taiwan. He's going to bring all that knowledge back over here to Harlem and use it here. But he's going to hopefully be back. I want to give a shout out to Valerie Wright, the producer. She's a little under the weather. She's going through it, but love you. It's all good. And without her, we would not be able to bring great guests like the doc right here. And make sure you tune in next week. Our topic of discussion, one of the main comorbidities here in Harlem is asthma. I'm sorry, asthma.
And arthritis too.
Yeah, arthritis too. But that's definitely going to be the topic next week. And if you have asthma, your children have asthma, or if you know someone that's going through it, tune in and listen to the show, because we're going to break it down into detail. As far as the myths, the misconceptions, the facts about asthma. And we're out of here. So this show is in dedication to Miss Gloria Thomas. Harlem, take care. I thank you for tuning in. And
protect your joints.
Don't
smoke.
And we're going to talk next week. Okay.
WHCR 90.3 FM, New York.
Oh, wisdom, only a fool, trusting his own eye and disregard correction. You got to be humble, free from anger, and your days shall be low. You gotta use every day. It's what we need today. You gotta use it, yeah. Every day. It's what we need today. Oh, wisdom. All right now. Oh, wisdom. Hey. Oh, wisdom. You got to have it, yeah. Oh, wisdom. All right. Rise up and smile. Don't be shy. With love in your eyes. You got to be conscious. You got to be righteous. Can't you see the sign of the time we're living in? Got to use it, yeah. Every day. It's what we need today. Oh. You got to use it, yeah. Every day. It's what we need today. Yeah. Wisdom and knowledge will guide you through. Don't you be the devil too. No, you can't guide a people without a vision. You shall surely go astray. You wisdom. Whether you wife or you dumb, an elder can teach you wisdom. Whether you're old or you're young, oh wisdom, oh wisdom, oh wisdom. Only a fool trust in his own eye and disregard correction. You got to be humble, free from anger, and your days shall be low. You gotta use every day. It's what we need today. You gotta use it, yeah. Every day. It's what we need today. Oh, wisdom. All right now. Oh, wisdom.
Fellow citizens of Africa, I greet you in the name of the Universal Negro Improvement Association and African Communities League of the World. As you are aware, the world in which we live today is divided into separate race groups and distinct nationalities. Each race and each nationality is endeavoring to work out its own destiny to the exclusion of other races and other nationalities. We hear the cry of England for the Englishman.